On our discussion segment today, we'll be joined by Ms. Mary Mwadu Joseph, Communications Manager at the Voice of Disability Initiative, and Mr. Gideon Eze, PRO for the Joint National Association of Persons with Disabilities, Enugu State Chapters, to shed light on disability inclusion effort and the urgent need for full implementation of the Enugu State Disability Right Law. You're welcome.
Thank you.
All right, Mr. Gideon, since the last time persons with disabilities were included in the state affairs, how would you rate the current state of their inclusion in 2025?
Well, I want to say that the inclusion has been fine, but there is an urgent call for a very magnanimous inclusion where the issues of persons with disabilities has to move away from charity-based to right-based approach, from a non-systemic approach to a very systemic approach. We recall last year, 2024, a last town hall meeting, our governor, His Excellency Dr. Peter Ndubisi made a very magnanimous pledge to us, telling us that the Disability Commission would be established and implemented fully before the first quarter of 2025. And we are still here. Yes, we know for him, he has a lot of things in his hands and he does a lot of work in different sectors. But we need to remind him to let people know, those who are closer to him or he himself watching us live at Afia TV, that we are here and that promise is yet to be fulfilled. And we want him to do that as speedy as possible because there is a lot of need for this establishment of the Disability Commission because we cannot talk of growing Enugu State economy from 4.4 GDP to 30 billion GDP without total inclusion. So that's it for me. All
right, okay. For you, Miss Mary, apart from the cases of abuse and discrimination, what real-life impact does this absence of a functional disability commission does to people living with disabilities, particularly for women and girls?
For women and girls, I believe I'll speak on the SRHR aspect of their lives, whereby many of them don't have access to their body, don't have access to certain medication. In fact, looking at this law, it's going to make sure that that hospitals have sign language interpreters, school have sign language interpreters, and anything that has stood as a barrier for them in every sphere of their lives. So this law will help their lives, will help enhance their living.
All right.
Yeah.
Mr. Kitchen, would you like to add anything to that?
Yes. More so, it's not just about living. It's about full dignity.
Yeah.
Because when we talk of this Disability Commission, it is a systemic way of including this person as part of governance, whereby, like the sexual rights and reproductive health of a girl child with disability. Now, if you look at the rate of gender-based violence is mostly predominantly seen among women and girls with disabilities. And the most painful part of this is that the society seems to look at this as just, as a privilege done to this person with disability, not knowing that it's an abuse in the rights and dignity of the human person. So when this commission comes to fully life, it will fight some of these menaces in the society, and it will help to give, life to the issues of persons with disabilities randomly and generally.
Okay, all right. Would you say health workers in Enugu are prepared to provide sexual and reproductive healthcare facilities for people living with disabilities?
Yes, for me, yes. They are, because one thing is all about training and retraining and upgrading. So, and if you recall, last time, Her Excellency, the First Lady of Nigeria, visited Enugu State with lots of gifts and packages, and among which was health kits. So, and when you look at this, you see that these things are already there, and the professionalisms are even there. But then we need a driving force We need something that will make this be very implementable, because when we talk of this disability commission and the disability law, when this law take into full effect, everything we need as persons with disabilities, like the ramp, like the sign language interpretation, like all the necessary things we need to be put in place, will be enforceable. They will be really done, because now, as it stands, the same as if persons with disabilities are just living on charity base. Yes, I know the current government of Enugu State, they are really trying in terms of disability advocacy and activism. But then, the systemization of this issue of persons with disabilities is what we are calling for, so that it will not be that when this government is over, another government comes in, then the talking begins all around again. So we want this to be a systematic something that has been instituted, an institution, because there's a lot to gain when this commission is here, because it's economically viable. It will even help the GDP. It will bring a lot of the tourists on disability matters will coming into Enugu State. So we need a lot of things to take place for this commission when it comes.
All right, pointing out these needs, are there specific training and supports that health workers need to make this forward?
Well, specific training, like professional health workers are supposed to be trained on sign language communication, and they are also supposed to be trained on disability management and communication, because when you look at persons with disabilities, there are some who require extreme mental health maintenance. And in managing communication on persons with disabilities, you look beyond the person's disability and try to, dignify his or personality or her personality as a person. For instance, there are some who will get to the hospitals because of a hearing impairment or visual impairment that will not really have access to medical facilities or medical personnel. But when they are well trained and then they know the value of all this coming through, you see that everyone will have the same inclusion level.
All right. Ms. Mary, would you like to add anything to that?
Yes, he has said it all. I believe most of the training that should be implemented is towards sign language interpretation and the disability management. You might not really understand what a person with disability is going through if you are not a person with disability yourself. And I believe in the disability community, there are a lot of people with ability. So, in fact, inclusion will help in escalating this issue to being executed, in the sense that, okay, if there's a sign language interpreter in a hospital and then there's a deaf person, already this person is part of the community. And as a nurse, I'm deaf as a nurse, I'll be able to communicate with my fellow deaf person. As a teacher, if I'm a deaf teacher or I'm a blind teacher, I'll be able to communicate with my fellow blind person. So this is part of where inclusion comes in, whereby if in every station, in every institute, you have persons with disability, there's employment for persons with disability, it will be able to help manage the inclusion, because everybody, I can understand you. He understands a blind person more than I can understand a blind person. A deaf person understands a deaf person more than I can understand a deaf person. So that's connection, that human connection, if we involve persons with disabilities in all spheres of life, will help in solving this issue.
All right. What would you say is the biggest barrier in implementing this inclusive healthcare?
The biggest barrier in implementing inclusive healthcare is just that same barrier that is, holding the implementation of the disability law, the full implementation, because the law has aspect of health. So when this law is fully implemented, with the commission established and the board hit running and everything is settled and set, you will see all of these things taking place gradually. They will just come in, because as part of life, because it's not just about health. What about housing? Persons with disabilities, what about housing? So, somehow you will even see a person with disability wanting to rent a house just like every other person. He has this money, and you will see the landlord coming in to say, no, I wouldn't want him or her to rent this house because he's just disabled.
Yeah.
Not minding. So there is a lot of things that very commission will work on as an institution of government. So whichever barrier we are facing now is as a result of the lack of the implementation of the Disability Commission here in Enugu State. Although the governments are doing their best to include persons with disabilities, but institutionalizing that inclusion and making it a systemic thing of governance is what is mostly important and appropriate rather than a charity base.
All right, Ms. Mary.
Yeah, I believe with the existence of this commission, persons with disability will be able to govern their affairs. And even in the aspect of data, I believe that commission will make provision of data when it comes to dealing with every sector in the government, whereby the commission will be able to, okay, these are the amounts of people, the numbers of people that needs help. These are the number of girls, women and girls. These are the issues. So it helps like giving units to everything, and which obviously, if there's no commission, the government, other ministries won't be able to do that. In fact, they will even need data to be able to help implement some of their programs. But with the commission available, it will give them that liberty of governing their affairs, of fighting for their community, of making sure that everything is being accessible. There's inclusion. In the case of stigma, in the case of other issues, that the small issues, all these things will be tackled with a commission available to govern the affairs of the disability community.
All right, thank you. What part should persons with disabilities themselves play in shaping and overseeing disability policies and programs?
Well, persons with disabilities should be at the vanguard. They should be the front burner of shaping policies for persons with disabilities. There are implementable policies that are supposed to be, ready. And then when this commission comes to life, whoever the group of persons with disabilities who may be appointed should know that the appointment is not just an ordinary government affairs appointment. This is a pure call to service, because it's a service to mankind, a service to humanity, and the kind of job that you are doing this job for your creator, the God in heaven, not just because you are doing it because you want to do a job. So it's a service delivery department of government, should it come to be. So persons with disability have a lot to play. They are supposed to be unity, oneness, love, community engagement and togetherness. So it's not about I am a person with disability and who cares. It's about I'm a person with disability and I should be special in all aspects of life.
Yeah. Ms. Mary.
Yeah, I also want to add, if you look at most cases of persons with disability, most cases is not an inborn cases whereby that person was not born with disability, either one or two issues, like for instance, I want to talk about my ED, the founder of Voice of Disability Initiative, Barrister Catherine. She became deaf at 9 years old due to injection issue, the medical name, but it was an injection that made her to be deaf. So you can imagine in this case, she's not the only person. If you look at data, if you look at statistics, you'll find that a lot of persons with disability have that issue because of certain negligence, either in the hospital or something that happened. But what do we have lawyers to prosecute? Do they have rights? Most times they're just being neglected and the issues just burn down. But these are things that will be addressed, and everybody will take into notice that, oh, I can't do this to persons with disability. I can't do this to any. It also involves human rights. You understand? It's the same thing as also making sure institutes, even let's talk for instance in the court of law. Do we have sign language interpreters there for lawyers that are deaf? Do you understand? So all these things are going to be in place. All these things, everybody will make sure that, okay, this is a law, and I don't want to, do any mistake that will make me go to jail or something. So everybody will be, you get, sorry, yeah.
All right. So for the final question today, what, apart from the urgent steps you've listed, what other steps do you think the government can take right now to ensure that people living with disability have the right law and move from real paper to real impact?
Well, the urgent step they should take immediately is just to, get this commission running. I'm telling you the honest truth. All of the challenges persons with disabilities are facing in Enugu State for now are embedded. The answer is embedded in that commission. Yes, the Ministry of Children, Gender Affairs and Social Development, who are the mother ministry for persons with disabilities, are doing exploits. I must commend the Honorable Commissioner for Children, Gender Affairs and Social Development, Mrs. Ngozi Eni. She's a real mom, because I can tell you that while every policies of governance and government is going on, as it regards to that ministry, she ensures the random inclusion of persons with disabilities in all spheres of activities as that ministry is concerned. Or be that as it may, the real thing is still needs to be done, because the real institution is that commission. And once it is established and it is well funded and is running, you'll see that other issues regarding to persons with disabilities will be handled as a pure governance affairs. And then from there, we will ensure that, okay, if this thing is not working, we will go to the commission and get whoever that was in charge of this and that and know why this is not functioning and that is not functioning. But for now, you can't really say, because there is a law, and this is the global thing, is something in, the world donors, funded agencies are willing to come to Enugu State to invest on persons with disabilities, but they need the right channel to do that, not on other means that may go in one way or the other. So I'm appealing to His Excellency, the Executive Governor of Enugu State, to please remember his promise on this sector of the society. So please at least make a shout out to persons with disabilities, so that we really know that our tomorrow is here as well. Because the tomorrow have come in various sectors, but in our own sector of disability community, I wouldn't know if the tomorrow will still come. But I know that it's here already. It's just for his pronouncement.
All right, Ms. Mary.
Yeah, I still want to appeal to His Excellency to look into this matter and then make this commission to be in existence. Because if you look at the normal day-to-day life in the country, well, a normal person, so to say, is going through a lot. What about a person with disability? The violation you face every day as a normal person, a person with disability faces that 2 times. So I know the governor is a person that says and do, not someone that just says and keep quiet. Yeah. So we urge him, we appeal him that he should act on his word and ensure that no one is left behind.
All right, thank you. Thank you for that.
Yeah.
And that's what you have for you on the news today. Do what flows on our social media platform. The Afia TV official, I'm Joan Udiniwu. Many thanks for watching.